I am presenting a fictitious case involving the acquisition and merger of two mental health agencies. Both agencies provide mental health assessments and substance abuse interventions, and they both cater to individuals and families who face financial barriers to access mental health services. When the new leadership starts an accreditation process to apply for a behavioral health clinic expansion grant, essential gaps in diversity and inclusion policies and practices become evident. The Department of Health and Human Services has established 15 standards known as the Culturally and Linguistically Appropriate Services Standards, or CLAS, to guarantee that all agencies receiving federal grants provide effective, equitable, and respectful quality care and services, and that the agencies are responsive to the diverse cultural health beliefs and practices, the preferred languages, and other communication needs of the population served. If there's no programmatic alignment with the 15 federal class standards, the agency's funding is on the line, which threatens the survival of the new company. Talk about a little bit about the companies that merged. The new company has a leadership now that is made up of mainly white male Americans. And the company number one that participated in the merger is representative of the demographics that they serve in Miami-Dade, with Latins, Blacks, white Americans, and other ethnicities. And of these, 54% are male, 42% are female, and 4% have openly presented themselves as LGBTQ. The company number two is a smaller company and is predominantly composed of Spanish-speaking Latins, 40% males and 60% females. Some of them speak fluid English. The C, the executive officer of the new company is very aware of the importance of inclusion, and he says, "This is not just about the funding; it is about the relationship the agency builds with individuals and families they serve." He believes a crucial factor in their work is being sensitive to each culture, family, and individual, both within the agency and in the community they serve, since all individuals have different health, illness, and healing beliefs and perspectives. To take a closer look, they decide to hire me as the change agent. And I observed right away that the company has not been following the Department of Health and Human Services class standards. And as I mentioned, this is required to obtain federal funds. The leadership needs to address this gap with a sense of urgency, not only because they need the grant, but because in the merging process, the company was going to hire and let go of some of the workers, and it was necessary to set up fair hiring and layoff criteria. So my guiding questions through the process of change are the following. What did inclusivity mean for each member of the company and what they offer to the community? How to establish and implement the NI best practices in the company? What channels needed to be created to guarantee communication and listen to employees' concerns and feedback? What criteria would the new company human resources office used to retain and lay off personnel? And we even consider if the company needed to hire an external consultant to get education on D&I matters. To study the case, I collect information from surveys and interviews, and the survey was applied to all, and the interviews to a sample of the personnel. The data revealed a generalized discontent among the staff and even mid-management, and people were discouraged about perceived discrimination. They were concerned about the mobbing practices that were revealed, and people complained that the opportunities to advance professionally were not the same for everybody. So we needed a best practices plan, and we agreed to set up a 100-day plan to launch and implement new strategies focused on cultivating a culture of inclusivity. The first step was to create a task force to address the issues with the awareness that diversity is about the numbers, but inclusion is about the impact, and therefore it is necessary to create a culture of inclusivity. Then we created a communication plan that allowed management to listen to the voices of staff and also the community. We started to educate the personnel on D&I matters, and also we established grievance and reconciliation procedures. Then we started to take steps to change the culture by increasing contact between diverse people. And this is done through creation of self-managed diverse teams, by rotating management trainees through departments, and we even organized a diversity festival to give people the opportunity to have a broader understanding of other persons' cultures and beliefs. After the 100 days, the company has put together a well articulated vision and has set up the mechanisms to increase the DNI and grant accountability. And as a result, the level of post-merger satisfaction has increased, and also the employees' commitment to the new agency. A culture of inclusion is starting to become evident because the differences are acknowledged and respected. All voices are heard because the communication plan is working, and it is also visible that the opportunities to advance professionally are starting to increase. Also, the accreditation and funding goals have been achieved, and a diverse, inclusive workforce understands the needs, beliefs, and concerns of the community better. And as a result, the agency is reaching to the community in a better way. So overall, we consider that the plan has been successful.